Hi, good afternoon, everybody. I'm Tracey Ingle. I have my legal assistant here today with me. This is Hunter. You can also see him in that picture over my shoulder. Of course, he chose now to be on the desktop because this is what happens when we work from home. We have all of our assistants. So coming to you live today, actually, I'm going to be coming to you live all day this week, well, through Thursday at 1 o'clock. To share with you some information about Medicaid. And the reason that I'm doing this, and I should say too, if you want to make sure that you're getting notifications about us going live, you make sure to like us on Facebook, and then you will get notifications when we go live. Seriously, you just can't plan this any better. But we're doing a series this week on the nuts and bolts of Medicaid. And I want to share some information with you about it, about nursing home care, long-term care, paying for it. Reason being, yes, it's a crazy time right now. We're heading into the holidays. And the holidays are typically a time that we get together with family. And it's in this year in particular, it may be family that you haven't seen in quite a while. And I want you to understand that this period of isolation we've been going through in social distancing and mask wearing and just staying home to be safe and not seeing our friends and our family, it is particularly hard on seniors and on our elders. And so what you may notice as you go visit family over the Thanksgiving holiday, over Christmas, Hanukkah, any of the holidays that you choose to celebrate, you may see family that you haven't seen in quite a while, whether it's, from the porch or you'll be together at a family gathering. And what you may notice is you may see some big changes. And this is often a time when we do see big changes in our family because we only see them once or twice a year, maybe 3 or 4 times a year, whatever it might be. And this time in particular, because you haven't seen them in quite a while and they really haven't been around anybody in quite a while, you may see some big changes. And you may start thinking, what's going to happen? I don't know if, mom can continue to live at home alone. I don't know if dad is safe. I'm concerned that someone might fall. These things may come up for you and you may start to question and wonder how you're going to cross that bridge when you get there. If they need care in particular, how is that going to get paid for? And that's what this Facebook Live series is going to be about the nuts and bolts of Medicaid to cover both home care, assisted living, well, thank you, sir, assisted living, and also nursing home care. And today, what we're talking about in particular is the difference between Medicare and Medicaid. And those are two things that they get used interchangeably all the time. They are not the same. They are definitely not the same. Everything that I am talking about today is coming straight out of our nuts and bolts guide that you can download and access for yourself at MassHealthGuide.com. This is kind of where the content is coming from that I'm going to be talking about this week. And we will also be doing a webinar in early December, and I'll share that URL with you too in a minute. My helper here. All right. So Medicare versus Medicaid. Medicare is what's called an entitlement program. And it's something that we are all entitled to because we've paid into the Social Security system during all the years that we've worked. So that then when we are older, Medicare becomes a primary health insurance for us. And so Medicare Part A is something that we all get. It covers catastrophic care. My helper just sat on my mouse. So it covers catastrophic care. Medicare Part B is the part that we pay a premium for that gets deducted out of your Social Security check that before it gets deposited every month. And then there's also Medicare Part D, which covers prescription drug coverage and what have you. But make no mistake, this is medical insurance that pays for typical care that you might need, whether it's an emergency at the hospital, routine doctor's visits, typical medical procedures, et cetera, et cetera. So Medicare does pay for some very limited nursing home care. It does not pay for anything, everything, all of it. It pays for very little nursing home care. Now he's going to go slack off in the corner. So Medicare pays when you've been in the hospital, you've been there at least 3 overnights, and then you need to have some rehab before you go home. And so what the Medicare system says is, yeah, that's reasonable. You know, you've been in the hospital a few days, a few nights. It's reasonable that you can't just go straight home, that you would need some physical therapy or occupational therapy, whatever it is. And so that rehab is what Medicare pays for. What happens is you transfer over to a rehab hospital, and you're getting this occupational therapy, you're getting, you know, whatever physical therapy you might need, and you continue to get better and get better and get better. So you're progressing through these therapies. At some point, you will plateau. And Medicare says, hey, okay, you've rehabbed, you're as rehabbed as you get, so we are now done paying. And so Medicare pays for that rehab. But if you're still not able to go home at that point, it's still not safe to go home at that point, Medicare does not continue paying. They pay for the rehab, they get you as rehabbed as you can be, and then that's when Medicare shuts off. Typically, people have some sort of a supplemental health insurance policy that picks up all their Medicare copays. And what you'll find is that that insurance pays whenever Medicare pays. So for Medicare, there are some caps on how long they'll pay. So they will pay for this rehab. They'll pay 100% for the first 20 days. And then for days 21 through 100, they pay about 80%. And then there's a copay. So your supplemental insurance will pick up the copay. So notice I said that Medicare will pay up to 100 days. So they're going to pay for this rehab up to 100 days. But if if you plateau, if you get as rehabbed as you can be, then Medicare will shut off. And that also means that supplemental health insurance policy will also shut off. And now you're left in a situation where you would need to privately pay for your continued stay at that rehab hospital. That's where Medicaid comes in. So Medicaid is a need-based program. Medicare is an entitlement program. We've paid into the Social Security system. That's what gets us our Social Security checks when we're of age, and it's also what gets us Medicare coverage. It's what gets us Medicare coverage to pay for our hospital stays, our rehab, etc. Medicaid, on the other hand, is a need-based program. And it will pay for nursing home stays so long as you meet their definition of need. And really, there's kind of 2 things that they look at. There is financial need and there's medical need. So you have to actually need to be in the rehab or nursing home facility. And then financially, there are a lot of tests, and that's what we're going to be talking about later on in the week. Tomorrow, we're going to talk a little about Medicaid to help pay for assisted living and home care, what those financial requirements look like. And then on Wednesday, we will talk a little about Medicaid for nursing home coverage, what those financial requirements look like, eligibility. And then on Thursday, we'll also talk about the actual application process and what to do after approval. Because submitting the application, getting that approval, you're not done. There's still more to do. So I mentioned everything that we're talking about this week is in that Medicaid guide. So you can download that. And then we will also be doing a webinar on December 9th at noon. And you can get more information about that at masshealthwebinar.com. You can also register for it. That will be a live webinar, so it's a great time if you have questions that you want to have answered. When we did this last May, there were a ton of questions that we took live, which was super helpful for me to know what you want to hear, and also certainly helpful for the people who had the questions. So we will, during that webinar, we will be doing live Q&A, examples, FAQs, all of that good stuff, so you can get more information there. So again, Medicare, Medicaid, two very different things. They cover similar stuff, but under very different circumstances. Medicare covers very little home care. We'll talk a little about Medicaid home care, what that can look like in assisted living. But generally think of Medicare covers rehab. It does not cover long-term stays in a nursing residence. Thank you so much for being here. If you are watching live, awesome to see you here. If you are watching a recording, feel free to post questions in the comments. Always happy to answer those questions and get information back to you. And I will see you tomorrow, same time, same channel at 1 p.m. Have a great rest of the day.